Good afternoon. My name is Lieutenant Colonel Torie Comeaux Plowden. I'm also a physician. I was a under 40 award winner in 2017, and I will serve as the Mistress of Ceremonies today for the Booker T. Washington Luncheon. Thank you all so much for attending. We're really, really very happy to have you here. Booker T. Washington started the National Negro Health Week in 1915. From 1921 to 1953, National Negro Health Week was a program supported by the National Public Service. April's National Minority Health Month is a descendant of National Minority Health Week. The awards received at this luncheon will recognize individuals and organizations that have made an outstanding contribution to the promotion of wellness within minority communities. Before we begin the presentation of awards, I would like to introduce National Minority Quality Forum's founder, president, and CEO, Dr. Gary Puckrein.
Thank you. I have the great pleasure of doing two things. First of all, I want to introduce Dr. C. Reynolds Barrett, president of Xavier College. Anybody who is interested in going to medical school or pharmacy school, Xavier College has been exemplary in leading the way there. I also want to take a moment to thank our contributors, for which we would not have this event if not for them. So Centene Corporation, Merck, Susan G. Komen Foundation, Amgen, the American Medical Association, GlaxoSmithKline, Health Service Corporation, Blue Cross Blue Shield, Eli Lilly, Otsuka, and Pharma. These are our gold and silver contributors, and we thank you very much for all that you've done for us. Thank you.
Thank you, Dr. Puckrein. And thank you again to all of our supporters. We really, really appreciate you. Now, after a brief video, we will hear from the president of the American Medical Association, Dr. David Barbe. Well, perhaps the video is after Dr. Barbe. So we will let you speak, please. Welcome.
We'll get all our sequences straight.
I became a member of the AMA when I was a resident.
There we go. Anyway, thank you very much, Dr. Plowden, for that introduction. And thank you. The AMA is really pleased to be part of your program today. You know, and in just a few minutes, the National Minority Quality Forum will present awards to two outstanding leaders, both of whom you know well, Dr. William Carson, Dr. Jerome Adams. And on behalf of the AMA, I really want to congratulate both of them heartily. Dr. Carson has had a distinguished career in medicine as a psychiatrist, as a marketing, research, and development strategist, and as an innovative chief executive at Otsuka. Dr. Jerome Adams was an outstanding state health commissioner in Indiana, and today he's making quite a mark on the national stage by taking on some very tough addiction and mental health issues in his new role as Surgeon General. I think you'll agree with me that he is doing an exceptional job, and recently issued an advisory on naloxone and opioid abuse, which was the first advisory from a Surgeon General's office in over 13 years. So we strongly endorse that advisory, and we applaud Dr. Adams for his leadership in the fight against the opioid epidemic, and we look forward to continuing our work with him. What you may not know is that in addition to Dr. Adams' very demanding day job, we are very, very proud that he's also an active member of the AMA. He's been active in our Minority Affairs section, and he served as an alternate delegate in our House of Delegates. So he has been an ardent supporter also of our Doctors Back to School program that sends volunteer physicians and medical students into schools to encourage underrepresented youth to consider careers as physicians. There they are. Dr. Adams is the personification, I think, of our new slogan, Members Move Medicine. AMA physicians, like Dr. Adams, are leading some of the most important work in medicine and pursuing solutions to its most difficult problems, such as the twin challenges of health inequity and underrepresentation of minority physicians in the medical profession. The AMA is addressing these challenges head-on. We cannot achieve health equity without ensuring that all people have access to quality, affordable care. Last year, during the debate over health system reform, the AMA was a leading voice against repeal of the Affordable Care Act. As physicians, we know that people who are uninsured live sicker and die younger. We said at a minimum, any legislative proposal being considered should first do no harm. We said that more people should be covered, not fewer. We asked Congress to work together to improve affordability and accessibility. And we said Congress must protect the safety net programs like Medicaid and CHIP. And we insisted that patient protections be maintained. These are our principles, and we will continue fighting for them. The AMA is also leading major public health campaigns to spread awareness about the devastating chronic diseases like diabetes and cardiovascular disease, conditions that disproportionately affect racial and ethnic minorities and which many people do not even realize they have. We're encouraging people to visit the website doihaveprediabetes.org and take a simple quiz to see if they're at risk for prediabetes, and if so, to take action before the diseases progress into full-blown diabetes. And we've fought successfully for payers like insurance companies and the Medicare program to include the proven diabetes prevention program as a covered benefit. And we're working with the American Heart Association on an initiative called Target BP, which is designed to reduce heart attacks and strokes by raising the awareness among both patients and urging medical practices to more aggressively pursue better blood pressure control in their patient populations. We're also working with national experts to find ways to improve blood pressure control rates for African Americans as they are much more likely to develop high blood pressure than other racial and ethnic groups. For way too long, minority communities have experienced an epidemic of gun violence. Sadly, though, it seems to take tragic events on a scale like Parkland, Las Vegas, Sandy Hook, or the Pulse nightclub shootings for that epidemic to get the attention that it deserves. The AMA's 2016 annual meeting began one day after the Pulse nightclub shooting in Orlando, and we immediately passed a policy calling gun violence in America a public health crisis and called on Congress to act. Thank you. Well, that was almost 2 years ago now. And since the Parkland shooting, we have renewed our demand that Congress lead by funding gun violence research, by improving the National Instant Criminal Background Check System, by expanding background checks and waiting periods, reinstating the ban on military-style assault weapons, and funding the much-needed mental health services. And I think you would agree with me that it has been very encouraging to see our young people from many diverse backgrounds marching for change and working to end gun violence. That is a threat they should never have to face in school or anywhere else. Increasing our successes in solving the challenges that I have mentioned and many others will not be possible without bringing more people from underrepresented minority backgrounds into the field of medicine. We know that the cost of medical school can deter some minority students from considering medicine, and that's why the AMA Foundation and the Minority Affairs section of the AMA sponsor a scholarship program for fourth-year medical students. And we know that it's important for young people to have role models of color to give them a sense of what is possible. And that's why we send physicians into schools to encourage young students to consider careers in medicine through our Doctors Back to School program that I mentioned earlier. And each year, our Minority Affairs section designates a day in early May as National Day of Action. Last year, on Doctors Back to School Day, more than 4,400 young people engaged with volunteer physicians and medical students. So we hope you will consider volunteering on or around May 9th this year in a program such as that. And each year, as part of our partnership with the NMQF, we sponsored a Doctors Back to School visit in conjunction with this meeting, and we've met with thousands of local minority students. And in fact, there are about 30 volunteers here at this summit who will visit Ron Brown High School this Wednesday morning to inspire about 200 African American teenage boys in the 9th and 10th grade to consider pursuing a career in medicine. So in closing, the AMA is privileged and very proud to be part of this forum again this year, and we applaud the great work that the groups represented here are doing. The AMA remains committed to the pursuit of access of health care and health equity for all Americans, with a special emphasis on minority populations. But I don't want you to just take my word for it. Dr. Frank Clark is the chair of the AMA's Minority Affairs Section Governing Council and an AMA member who is moving medicine. I'll conclude by letting you hear from Dr. Clark about the Doctors Back to School program and other ways that his membership in the AMA is giving him the ability to shape the future and to bring about real change on issues of diversity and health equity. So let's watch this video.
I became a member of the AMA when I was a resident, in my second year of residency, and I was encouraged to go to my first meeting by one of my mentors. I was telling her that I didn't see a lot of black males in medicine, and that troubled me, and she encouraged me to check out the AMA if I wanted to be an agent of change and advocate and help shape policy. This organization was the place to do it, and I found that to be true. In addition to my practice, I serve as the chair of the Minority Affairs Section Governing Council of the AMA. Having a seat at the table allows for collaboration, allows for networking, allows for myself and my colleagues to help shape policy when it comes to eliminating healthcare disparities. As we know, one of the strategic initiatives for the AMA is improving health outcomes. I don't feel that that can happen unless we diversify the physician workforce in order to meet the needs of a growing and diverse population. For me, it's about giving back to the community. And when I'm doing Doctors Back to School programs for kids and seeing their face illuminate when they see a black male physician for the first time, and letting them know that, yes, if I can do it, so can you.
Thanks again, Dr. Barbe, and thank you for sharing that really inspiring video with us. So I'm going to now move forward and talk about our award winners. Our Outstanding Corporate Citizen Award goes to William H. Carson, MD, the President and CEO of Otska Pharmaceutical Development and Commercialization, Inc. He is responsible for leading the team that develops new products and brings them to market, as well as creating strategic plans for the company's product portfolio to ensure development programs meet quality and safety standards required by medical and regulatory agencies. In addition, Bill serves as the company's representative to regulatory and legislative agencies and oversees the company's product portfolio investments. Since his appointment in 2010, Bill has led the development efforts of compounds in neuroscience, cardiorenal, and oncology, and he was instrumental in the development and regulation of Abilify Maintainer for extended-release injectable suspension. In addition, he helped to guide the development and registration of SAMSCA, marking the first time Otska successfully developed and commercialized a product entirely on its own in the United States. He joined Otska in 2002 as a board-certified psychiatrist and served as OPDC's Senior Vice President, Global Clinical Development, overseeing the development of Otska's discovered compounds. During his career there and earlier at Bristol-Myers Squibb, Bill was one of the key drivers in the development and commercialization of Abilify, which Otska marketed in collaboration with BMS. Among his many contributions, he led the aripiprazole pediatric efficacy trials team, which started the life cycle management programs at OTSCA. Prior to joining OTSCA, Bill was Group Director in Neuroscience Clinical Research and Development at BMS, responsible for the clinical development of Abilify. Earlier in his career, he was an Associate Professor and Director of the Inpatient and Partial Hospital Program at the Medical University of South Carolina. Bill received an AB degree in History and Science from Harvard University and earned an MD degree from Case Western Reserve University. Ladies and gentlemen, please welcome our 2018 Outstanding Corporate Citizen, Dr. William Carson.
Thank you, Dr. Plowden. And I'd like to thank the National Minority Quality Forum and Dr. Puckrein for inviting me here. I'd like to thank Dr. Barbe and the AMA for the kind introduction. And this luncheon is the Booker T. Washington luncheon. And I'm having a bit of a full circle moment because I grew up in Columbia, South Carolina. My father taught for most of his career at Booker T. Washington High School. And so that kind of takes me back in a very nostalgic way. I would love to say something that is inspirational, and maybe I can get to the inspiration at the end of what I would say. But about a year ago, one of my classmates from high school called me, pretty desperate. And he said, Bill, my son is in the emergency room here in South Carolina, and we don't really know what to do. And I said, well, what's going on? And he was having some challenges, being oppositional, maybe a little marijuana use, you know, typical teenager. And the person who was on call gave him this advice. He said, you know, I think you should just let him go to jail. And I said, absolutely not. Let's talk about what you need to do. So you go back, you find out who the attending psychiatrist is on call, and you tell that person that you want to understand what are the medications, how are they planning to manage him, et cetera, et cetera. And subsequent to that, the son did not go to jail. He did get an evaluation. But as a psychiatrist and when I was growing up, one of the things that really was on my mind in medical school was how do I support and advocate for patients? And the patients who spoke to me the most with regards to needing advocacy were psychiatric patients. And that was really the lever that got me to go into psychiatry. As Dr. Plowden said earlier, I was on faculty for 10 years at the Medical University of South Carolina in the Department of Psychiatry and Behavioral Sciences before I joined the pharmaceutical industry. On a daily basis, I had anywhere between 13 and 15 patients a day for 10 years. So everyone always says to me, what is it like for you to leave medicine to join the pharmaceutical industry? And I said, I don't think about leaving medicine at all. I left from the everyday practice of medicine. But with the approval of Abilify, in the first month the drug was on the market, there were more patients treated with Abilify than all the patients that I took care of in the 10 years of service in the hospital. So my career in the pharmaceutical industry up until the approval of digital medicine, Abilify MySite in November, it really is about advocating for those patients where there is no advocate. So as I move forward, I think I'm going to be moving into the third half of my career. I don't exactly know what that is going to look like at this point in time, but one of the things that I'm going to make key for how I focus at that point in time is on really getting to a place where we don't have to hear, and this is the way that I usually describe it. If your wife, mother, child is having some sort of major illness, let's say diabetes, hypertension, any number of things, would anyone ever say the best place to take care of them is a jail? So why do we treat psychiatric illnesses any differently? And we need to think about how do you get equity and parity for mental illnesses in the same way that we have for all other illnesses. Thank you very much for this award. I hope to be able to come back when that happens.
Congratulations again, Dr. Carson, and thank you so much for those words, which are really inspiring. You've given us a lot to ponder. And now I'll introduce our awardee for the second award. The Booker T. Washington Award goes to Dr. Jerome M. Adams, the 20th Surgeon General of the United States. He was sworn into office by the Vice President in 2017. Dr. Adams, a board-certified anesthesiologist, served as Indiana State Health Commissioner from 2014 to 2017. Dr. Adams, a Maryland native, has bachelor's degrees in both biochemistry and psychology from the University of Maryland, Baltimore County, a Master of Public Health degree from the University of California at Berkeley, and a medical degree from Indiana University School of Medicine. Dr. Adams was also an associate professor of clinical anesthesia at Indiana University School of Medicine and a staff anesthesiologist, where he was chair of the Pharmacy and Therapeutics Committee. He has served in leadership positions at a number of professional organizations, including the American Medical Association, the Indiana State Medical Association, and the Indiana Society of Anesthesiologists. He is the immediate past chair of the Professional Diversity Committee for the American Society of Anesthesiologists. As Health Commissioner, Dr. Adams presided over Indiana's efforts to deal with the state's unprecedented HIV outbreak. In this capacity, he worked directly with the Centers for Disease Control and Prevention, as well as with the state and local health officials and community leaders, and brought the widest range of resources, policies, and care available to stem the epidemic affecting the community. He has helped with the successful launch of Indiana's state-based, consumer-driven alternative to Medicaid expansion, and worked with the state legislature to secure more than $10 million to combat infant mortality in high-risk areas of the state. Dr. Adams' motto as Surgeon General is better health through better partnerships. As Surgeon General, Dr. Adams is committed to maintaining strong relationships with the public health community and forging new partnerships with non-traditional partners, including business and law enforcement. He has pledged to lead with science, facilitate locally led solutions to the nation's most difficult health problems, and deliver high-quality health care at lower costs through patient and community engagement, as well as through better prevention. As Surgeon General, Dr. Adams oversees the operations of the U.S. Public Health Service Commission Corps, which has approximately 6,500 uniformed health officers who serve in nearly 600 locations around the world to promote, protect, and advance the health and safety of our nation and our world. Ladies and gentlemen, please welcome our 2018 Booker T. Washington Award winner, Jerome M. Adams, our 20th Surgeon General of the United States.
Well, good afternoon, everyone. Thank you so much, Dr. Plowden. It's pretty awesome to be up on the stage with her. She is an OBGYN. She's double boarded. She wears that uniform well, doesn't she? It's just so inspiring to be around so many folks such as Dr. Plowden, who are doing great things to address health and improve disparities in our nation. Congratulations, Dr. Carson. Well-deserved, very well-deserved. And thank you, Dr. Barbe, to you, to the AMA. Frank, where are you? Frank, are you here? Frank, thank you so much for the support from the Minority Affairs section. It really is humbling to be here because I don't deserve the credit. Really, all I've done is try to lower obstacles for folks to do great work and to lift up the great work that's being done out there. That's what I did in Scott County, Indiana, and that's what I continue to try to do as United States Surgeon General. Thank you to the National Minority Quality Forum for all the great work you've done for many years to improve minority health and to help folks understand the burden of disease in our country. And thank you for the Booker T. Washington Award. You know, one of my favorite quotes from Booker T. Washington is that in all things that are purely social, we can be separate as the fingers, yet one as in the hand in all things for mutual progress. In my previous work as State Health Officer of Indiana, and now as America's doctor, I continually emphasize the value of teamwork to achieve mutual progress. As mentioned, as your Surgeon General, I do a number of different things. I oversee the United States Public Health Service, and the Public Health Service not only is charged with improving and protecting America's health, but of helping those who are disproportionately impacted by disease in our country. I had the opportunity to go to Puerto Rico and the U.S. Virgin Islands just this past fall after our 3 Category 5 hurricanes in a row, and to see the devastating impact that a hurricane can have not just on communities in general, but particularly on communities that are resource poor and don't have the capacity to be able to respond to disasters in a way that other communities do. Our officers were the only uniformed service on the ground providing care in Africa during the Ebola outbreak. And one of the most frustrating things for me about the Ebola outbreak is that I don't feel like we've leveraged that to the degree that we could have and should have to emphasize the importance of global health, to emphasize the importance of taking care of minorities, to take care of all folks so that we can deal with disease where it is and before it gets out of control. As Surgeon General, I'm focused on promoting health, preventing disease, and leading with the science. I believe with every fiber of my being, and I want you all to hear this, that every American deserves to live a long and healthy life. Unfortunately, we're falling short of that goal. Life expectancy has declined for the 2nd year in a row in the United States. I represent the first generation of parents in the last 50 years that's going to have to look their kids in the eye as of right now and say, you know what? You might not live as long as me. You might not live as long as your mother or your father. And as everyone in this room knows and is concerned about, even a greater amount of excess morbidity and mortality exists in minority communities. My vision is for better health through better partnerships. It's really just a way of saying, in all things, acting essential as a hand. We can only change our collective futures together. Regardless of what area you work in, and I've just been blown away by the people I've met already and the diversity that's represented in this room. We all have unique opportunities to leverage our influence and our leadership to convene stakeholders and to forge greater partnerships that can even more effectively promote health and prevention. As Dr. Carson illustrated, you can be part of industry, you can be part of government, you can provide clinical care, as Dr. Plowden did just this morning before she came here to introduce me. There are many ways that we can lift up health, but we have to work together. And as Surgeon General, I'm committed to using my platform to strengthen connections within the public health community and to forge more partnerships with non-traditional partners. These partners have to include business, law enforcement, as you mentioned. What you said was completely true. The story you shared, and I'm sorry, I don't want to take away from your time, but many of you all are familiar with this. Some of you may not be. My own brother Philip sits in state prison about 10 miles away from where we're having lunch right now. He was put in jail for 10 years for stealing $200 to support his addiction habit. So unfortunately, he was the one that was sent to jail. 10 years. And I don't say that because I want you all to feel sorry for him or for me. I'm a pragmatist. It costs about $150 to $200 a day to incarcerate someone, times 365 days a year, times 10 years. Not me. All of you, all of us are going to pay over $500,000 to incarcerate him in taxpayer funds. How much would it have been to have connected him with care and to have treated his depression so that he didn't self-medicate? So many missed opportunities. If we didn't catch him at that point, could we have caught him when he first started experimenting with medications and intervened to take him along a different pathway? Or the first time he was arrested for possession and provided him alternatives? So many opportunities that we have to be better partners with the law enforcement community. The educational community is critically important. Military and faith-based communities are critically important. And faith-based communities, we really, I think, as representatives and advocates for minority communities, need to do a better job of leveraging relationships with the faith-based communities because they're already out there. They already are in touch with the people who we're trying to reach. A tremendous opportunity there. But we cannot achieve our individual or mutual goals unless we're at the table together, sharing lessons learned and challenging each other to do more, to do better, and to do it together. Before I take my seat, I want to update you on one of my priority topics, our country's opioid epidemic. Today in America, addiction is a public health crisis. An estimated 2.1 million people struggle with opioid use disorder. There's a person dying of opioid overdose every 12.5 minutes. And here's what's shocking, folks. Over half of them are dying at home. That means on the other side of that bathroom door, on the other side of that bedroom wall, is someone who potentially could have intervened and saved that life. The opioid epidemic doesn't discriminate. People of all colors are dying. However, there's a substantial impact on racial and ethnic minorities and disadvantaged populations. In 2016, Black and African American youth 12 to 17 were more likely than whites to have used opioids in the past year. This alarming data shows that we're moving in the wrong direction and may be a precursor to even more opioid overdoses in the Black community in coming years. We have to be vigilant. You hear folks talk about the fact that overdose rates have doubled across the country, and particularly in white communities. Well, in that same amount of time, overdose rates for African Americans have tripled. We have to pay attention to this. We have to intervene. And I'm going to sidetrack again for a little bit, and then I'll finish up. One of the questions I most commonly get is, well, are you upset that folks are paying attention to it now that white people are dying? You know, I'll tell you the most honest answer I can give you to that question. We talk about stigma. What is stigma? Stigma is when we can separate a group of people into us and them. And that's what's happened throughout the years. We've separated folks into us and them and said them, they don't deserve respect. They don't deserve to be treated as if they have a disease. Whereas us, we're good. We're good. We deserve something different. Well, I do not deny what happened in the past, nor do I think any of us should. But the reality is we've been fighting for decades to get them to not see it as us and them, to get them to see it as all of us are affected, and we have an opportunity now with the opioid epidemic to do that. What I'm focused on is making sure the programs the funding, the remedies to the opioid epidemic are going to be applied in an equitable way so that we can decrease disparities and not further increase those disparities with the money and the funding and the programs only going to certain communities. That's what I implore you to focus on. We have to remember how we got here so we don't repeat our mistakes, but we've also got to look forward and not so much looking back, not so much look backwards. And as your Surgeon General, that's what I'm committed to. That's what I'm fighting for each and every day in those rooms, in those meetings, in those discussions, is making sure all communities benefit and that the funding and the programs go to the communities that are affected the most. As your Surgeon General, I'm focused on 3 key aspects of the opioid crisis. As you may have heard, I had an advisory last week focused on getting naloxone in the hands of not only first responders, but of those individuals at home who are on the other side of that wall, of that door, so that we can save lives. Our Surgeon General's advisory really calls people to recognize who's at risk for an opioid overdose, because it may not be who you think. If you looked at my brother back when he was going down his unfortunate pathway, you wouldn't have identified him by looking at him as someone who was misusing drugs. You wouldn't have identified him as someone who ultimately would go on to inject heroin. You wouldn't identify him as someone who would be at risk for overdose. You know, the most shocking thing about my brother being in prison right now is with fentanyl and carfentanil out there and overdoses going up, at times I'm actually glad he's where he is because at least he's alive. We've got to do better. It starts with recognizing that each of us has a role to play. Any one of us can save a life by carrying naloxone. I'm also working to educate the public about the severity of the epidemic and working with our communities again to destigmatize addiction, to show them that it can affect anyone and everyone. And third, we've got to prevent addiction before it starts. We're working with healthcare professionals, many of you in this room, to improve safe prescribing practices. One more small tangent, and I'm going to finish up in 30 seconds. But it's important for the folks in this room to recognize. Interestingly enough, one of the reasons African American, Latino, minority communities were not as affected by the opioid epidemic is because they were long undertreated for pain. We have to recognize that as we get rid of the overprescribing of opioids, we've got to replace it with good quality pain management that everyone can access in every hospital, in every community. Otherwise, we're just going to keep going through that revolving door and end up in an unfortunate situation all over again. Better prescribing practices aren't just about decreasing opioids. They're about providing good quality pain management, providing alternatives, and making sure everyone has access. And as an anesthesiologist, I can tell you, I've been involved with studies where women who were going into labor were not offered epidurals at the same rates that their non-minority partners were. I'm a regional anesthesiologist. I can tell you that even in the hospitals where I work, minorities are not offered alternatives to opioids to the degree that other folks are. Why? Well, we can't trust them to go home with that catheter in. They won't take care of that. They'll never come back. They're just going to sue us if we do this other alternative. They just want opioids. We're dealing with stigma each and every day, and we have to tear down that stigma and provide good quality pain management. I'll close by recognizing that every single one of you in this room is a leader in your community, and that means you have not only an opportunity, but a responsibility to lead by example. One of the ways you can lead by example is by knowing about and carrying naloxone and using my advisory as an opportunity to have broader discussions in the community about the need for more treatment resources, more recovery options out there, including housing, including jobs, including all the things that we know are necessary for good recovery, including housing, to talk about prevention, to talk about better pain management. Booker T. Washington had the right idea. By working together on all things essential to mutual progress, the health of minorities can, and I believe it will, it absolutely will continue to improve. I was in Arkansas last week with Jocelyn Elders. Had a great conversation with her. We were on a panel together. Arkansas has some of the worst health statistics in the nation. You know, when I was Indiana State Health Commissioner, the rankings would come out, and we'd kind of tongue-in-cheek say, well, thank goodness for Arkansas, because they're the only ones making us look good. You can get frustrated. You can get down when you look at the statistics, when you look at the numbers, but one of the things that blew me away about Arkansas, and even about Tennessee when I was there a few weeks ago, is they had tremendous partnerships, tremendous opportunities, folks coming together to address health in their communities and specifically to address minority health. So don't get down. We need to know where the disparities exist. We need to know what the statistics are. We need to be cognizant of it, but we've also got to have hope. And I do have hope. I have hope that by us all working together, when my brother does get out of jail, we can recognize his disease for what it is and not consider him a moral failure. That we can have opportunities out there for him to become a productive member of society and not just put him back in the same environment that he was in before with the same lack of resources that will end up putting him back in the same situation that he's in right now. Thank you to the National Minority Quality Forum for this exceptional award. It really does mean a lot to me. Thank you, Dr. Puckrein, for helping to lift up the National Minority Quality Forum. It's been a pleasure to have a little bit of time to address all of you, and I applaud you for your leadership to improve the health of minority communities. And as your Surgeon General, I look forward to partnering with each of you, lifting up the great work that you're doing, and continuing to tear down obstacles so that together we can improve not just minority health, but our entire nation's health. Thank you so much.
Well, thank you everyone for joining us today. I hope that you enjoyed your luncheon. I hope that you have enjoyed these inspirational words that our award winners gave to us today. There is still much work to be done, and their words have inspired us to continue to do that work. Congratulations again, Dr. Carson and Dr. Adams. Thank you. Have a good day.